There are now at least three variants of COVID-19 circulating, all raising alarm. What impact will new mutations have on current vaccines and our ability to control the virus? Dr. Zachary Jenkins is an associate professor of pharmacy practice at Cedarville University. He's an active member of the pharmacy profession and currently serves within the leadership of several professional organizations. His research interests include subjects related to infectious disease. Thanks so much for joining us today.
Thanks for having me.
So this is really a moving target. There's new information seems every day. We know there are at least three variant strains of this virus. Where are we at right now in our understanding of those mutations?
So thus far, what they've really been trying to do is sequence the mutations with the hopes that we'd be able to identify it a little bit more rapidly in populations. Right now, if you actually get a test for COVID-19, really we're picking up on the presence of the virus, but not necessarily the mutations of that virus. And so the hope is by sequencing it, not only can we help with the testing capabilities where we might be able to isolate the viruses, but also potentially the ability to more effectively treat these cases of the variants, as well as have vaccines that are effective against them.
Well, and we know certainly that there is a higher transmission rate with many of these. Do we know if they are also more deadly?
So there is some suspicion with the United Kingdom variant that it is perhaps more deadly. Some of their authorities have actually made claims about that already. Right now, I would say our best guess is it's a possibility. We don't necessarily have all of the evidence together to really indicate that it is more deadly. One concern we have are some of the therapeutics that have been developed, like the artificial antibodies that we've been kind of investigating. They don't seem to necessarily be as effective against some of these variants due to the mutation on the spike protein in these cells, which also happens to be a target for these vaccines that we have. So what that means in terms of the fatality rates associated with these is a little bit difficult to determine at this time.
Well, that the virus is evolving and mutating as it goes along is really not remarkable. It's what viruses do. In order to mutate, they need to replicate. Is it possible to explain what causes virus mutations in really simple, basic terms?
Sure. So sometimes if you think about a host cell and your machinery in a cell, almost like a printer, what ends up happening is sometimes your printer is misaligned and things don't come out the way you would anticipate. When you think about what that means for a virus, when a virus shares its genetic data and tells your cell to make more of itself, sometimes the process of making more of itself creates these mutations where it's misread by the cell. Over time, then, if those mutations actually happen to make it adapt to their environment more, they end up surviving and being sometimes more virulent, more infectious, sometimes more deadly, sometimes. And that's what kind of creates this challenge as we see large amounts of viruses moving through a population. They can kind of select out for these mutations.
Well, we know that these variants are jumping continents rapidly, adding stress to already overstressed healthcare systems. And I think you've alluded to it. What makes a variant more contagious than another?
Well, it really does kind of depend on the variant in question. Sometimes variants will survive better in certain conditions. We know, for example, other coronaviruses are affected by heat, by humidity, where they don't grow as fast in some cases. Well, a variant could be created where it does survive a little bit better, for example. So that's one small instance of something that can happen. There are a lot of other things, like maybe the particles could float around in the air for longer periods of time. Maybe it could evade host immunity a little bit more effectively. And those are just a few examples of ways that viruses can mutate.
Well, you've mentioned that these mutants could impact vaccine rollouts around the world. As we said, it's truly a moving target. But there are also suggestions that the vaccine may not be as effective against certain variants, as well as potentially people who have already had COVID. Could they potentially be reinfected by these different variants?
So there is a possibility in general that if someone had COVID a certain period ago and they're exposed to one of these new variants, that they could potentially be reinfected. Now, how badly they're reinfected is sort of a bit of a debate. In some cases, what we can say is they have some probable immunity that they've hung on to, so to speak. But when they're exposed to this new variant, they may not have that full response that they're able to mount. That's, of course, all affected by how long ago they've been infected. because we do know that natural immunity only lasts a certain period of time. Estimates range from 3 to 8 months, with 3 to 5 months kind of being that average range we see in most people. So I think that's going to be a challenge with some of our patients that have had this before, as we kind of think about the efforts towards herd immunity and vaccination.
Well, I think I read today that there's are drug companies who are already working on new vaccines to target the new variants. Have you heard anything about that?
Yeah, so one of the big strategies that a lot of the companies that have been developing these different vaccines have really put forward is this idea of creating a booster shot. And the idea behind this is, while the vaccines that are in existence do protect against the most dominant strains that have existed of COVID-19 to date, when we think about the boosters, what they'll do is they'll actually provide that extra security, the extra layer of protection specific against these variants. So they'll actually include data in these vaccines that will code against these mutations that we've seen. So there'll probably be a bit of a lag time there as far as development goes. The good news is, with some of the technology, like the messenger RNA vaccines that we've heard so much about, they're able to actually make those modifications pretty rapidly, which does mean we could probably see that in record-setting time if you really think about it.
Well, as we said, this is likely not the last we'll hear of new strains. What do all these different strains mean for pandemic recovery? What do scientists fear most about these mutations?
There are a few issues I think that we are pretty concerned with when it comes to these mutations. One of which is, as we are attempting to vaccinate our populations throughout the world, what does that mean if we have a real variant that emerges and creates these new waves of infection? So we've seen a peak in many parts of the world right now, the worst peaks in some cases, and that's going down. Well, if a new variant emerges that happens to be more infectious, like the United Kingdom variant, for example, which is about 70% more infectious, and it encounters a population that is more at risk, all of a sudden you have another wave that emerges. And it's very hard to then control that through herd immunity and using these vaccinations. Um, that's one big concern for sure. I think another big concern we have is, if we can't vaccinate enough people, there is the potential for more mutants to emerge. Right now, one of the real issues we're running into is this virus is able to move through people so quickly, since people don't really have a lot of immunity already to it. So the potentiation for those mutants occurring is much, much higher if you think about it. So one of the other benefits to a vaccine outside of protecting people is actually decreasing the amount of travel the virus is able to do, which means more mutations in a lot of ways.
So, I guess in the face of these mutating viruses, and even with the availability of vaccines, will the recommendations regarding mask wearing, social distancing, keeping your hands washed, not traveling, will those all remain the same?
That's a very good question. So when we look at the actual studies behind these different vaccines as they were approved, at least with regards to the Moderna and the Pfizer vaccines, they only studied the decrease in severe infection as their primary outcome. So what that really means is, this cut back on hospitalization rates, these cut back on deaths associated with COVID-19, and they were remarkably effective in that realm. They didn't look very closely at how much they prevented mild infections or how often they prevented transmission. Now, the Moderna vaccine had a little bit of data there that talked about preventing transmission, and they showed that it decreased the amount of virus that people carry. But what that means is, since we don't have the actual studies to back up this idea of preventing transmission, it's hard to universally recommend moving away from masks and distancing in people that have been vaccinated. In all likelihood, there's probably some level of protection. So as we get that data, and these manufacturers are actively looking at these, regulatory bodies throughout the world are encouraging them to do this. As we get that data, we should be able to move to this place where people that are vaccinated probably can be around other people that have been vaccinated without any fear. And so I think that's probably what we'll see emerging over the next several months.
So much valuable information there, Dr. Jenkins. Thanks so much for giving us the 360 on this mutating coronavirus. We really appreciate your time.
Absolutely. I'm happy to help.